Hi guys, I'm going to teach you a little bit about the care and feeding of newborn kittens. This is a newborn kitten. He is approximately 4 days old. He was abandoned by his mom, genuinely abandoned. Sometimes people think kittens are abandoned and they're not actually abandoned. I'll talk about that in another video, but you can tell that this is a newborn by the ratty little face, the fact that the eyes are still closed, the ears being kind of folded forward, and also he still has his umbilical cord attached, which happens quite a bit. This little guy has been fed already, so he's pretty full and sleepy, but you can hear the other one still needs to be fed, so he's setting up kind of a ruckus behind me, but yeah, so this is what a newborn kitten looks like. Okay, these are our newborn kitten feeding supplies. We have a 3cc syringe with no needle. We have a tiny little bottle nipple. You can get these at most pet stores. They come with the bottles. Right now these guys are a little bit too small to be drinking out of bottles. They don't quite have the suction power. It'll be another few days before I try them on a bottle, but the nipple has a teeny weeny little hole in it, which the camera will not focus on, but that's okay. The other thing that you're going to need is probably a blanket or a rag or something to feed them on. And, of course, here is my thing of kitten formula. It's still warm. Let's see, you can see kitten formula. That's another thing that you can get at most stores, pet stores and stuff. They have both the bottle, the cans of it that's already liquid, and they have powder. When the kittens are this small, I like to buy the cans because they'll go through it pretty fast, and because of how frequently that you feed them. When they're a little bit, and also you have to feed them so much that, like so often, that any time that you can save yourself is time that you can spend doing other stuff. When they get a little bit older and the feeding is a little bit less frequent, it's not quite as bad. So I like to use the powder because it's cheaper. Anyway, so I'm going to get to it and I'll show you how to feed them with this little weird setup. Okay, this is the other kitten. He has, as you can see, he has one eye open. This happens sometimes a little bit too early. Usually it's fine, you just have to keep an eye on it to make sure that they don't get infected or anything. Normally their eyes don't open until they're about 10 days old, but sometimes it happens through trauma, or another cat will claw at their eye or something like that, and so you just have to keep an eye on them. I have the bottle, or the syringe, full of about 3 cc's of milk. Now what you do is you want to hold the kitten on your lap flat. Some people like to burrito them in a blanket or something like that. I've never been able to get that to work. If you can, more power to you. But you keep the kitten flat on your lap as much as possible. You never feed them on their back because they could aspirate formula. And then you just sort of gently guide them to the nipple and squirt it into their mouth. And there we go. Alright, you want to keep their head slightly elevated because that's how they feed from mom. And you just sort of gently apply pressure to the end of the syringe so that gives them a little bit of assistance with the suckling. So, yeah, you see how he's kind of flailing in the air. That's because he can't quite. Normally when they're on mom, they'll knead on her belly so that they can assist with the milk flow. But he doesn't need to do that, but he doesn't know that, so he's going to do it anyway. And you have to press very slowly. You don't want to press too hard. So if you press too hard, then you could force the milk into their lungs and they'll aspirate it. And that's no good. It can cause pneumonia, which causes dead kittens, which nobody likes. So just keep an eye on them. Usually you can tell if you're doing that because the milk will bubble out of their nose. If you do that, then stop immediately. If you have one of those little bulbs, squishy bulbs that you can, that they use, you know, for cleaning out infant noses and so on, sinuses, you can use that to try and suck some of the stuff out of their lungs. But that's kind of an advanced technique. Let's see, here we go. Alright. And they'll struggle a little bit sometimes because they're not really sure what's happening. Yeah, remember, at this age they're pretty dumb. They're just little machines that eat. And, you know, you have to kind of teach them how to do this because they're not used to something that requires this much work. So you kind of got to work with their instincts. Yeah, I know. I'm sorry. You were getting off of it. Come on, little dude. Alright, let's make sure that thing... You gotta make sure that the nipple is very firmly on the syringe. Otherwise, it might leak. It was leaking a little bit, but he was still drinking. So I could feel his little belly swelling up. They will get a little bit of air when they're drinking. So what you want to do after they're done feeding is burp them, which I'll show you how to do in a minute. Yeah, you got it. Let's see. He might be full. He already had one full syringe of these. He's still squeaking, so I'm going to see if I can get him to drink the rest of this. Come on. Yeah. Say huh? Uh-huh. There we go. Good boy. Yeah. Just very gently put that in there. And just kind of keep them supported. Make sure they don't flip over. Make sure that they're drinking consistently. Yeah, that's a good boy. Yeah, come on. Alright, almost done. Just a little bit more. Just a little bit more. Good boy. And you can see it takes a little while because you don't want to do it too fast. You want to make sure that they're getting exactly what they need. And he's a messy eater. He's dripping all over the place. Come on. Yeah. And you want to watch for a little throat going, and sometimes their little ears twitch. That's a good sign that they are swallowing. They're getting stuff in there. There we go. Voila! All done. Now he is really full. You can see little belly is kind of fat. Now, I'm going to show you how to clean off his little face, just to make sure he doesn't get any sticky stuff on his face. Oh, sweetie, sweetie. Alright, now I'm going to show you the proper method for burping a kitten. Take your rag, just like with a baby, throw it over your shoulder, put the kitten upright on your shoulder, hold them like this, and what you want to do is kind of brace their little belly right here with your fingers and kind of massage like a mama cat would. And you tap gently on their back, and eventually you'll hear a little burp. You probably won't be able to hear it on the camera because they kind of go whoop. But keep doing that. Just stroke them. Tap the back very gently with one or two fingers. Oh, sweetie. And you also just kind of want to take this opportunity to like stroke them and pet them and give them a little bit of stimulation, because this is at the point where if they still had mom, they still had mom would be grooming them. So you want to simulate grooming by giving them lots of physical affection and touching and rubbing and massaging and scritching. So it's good for them. And it's fun for you. At least when they're clean. When they're gross and poopy, it's a little bit less fun, but you know, it happens. That's something, poop happens. Alright, I He's burped. See, his little belly is a little bit less distended. It might be hard to tell if you're not if you're not used to it, but yeah, now he's pretty good. He's pretty good. So he ate about 6 cc's per feeding is really good for kittens this size. If you want to be exact, you should get a little postal scale and weigh them on that before you feed them, and that will really help you be accurate as to how often and how much you should be feeding them per feeding time per feeding. At this age, you really should be feeding them every 2 to 3 hours, and you can let yourself sleep about 4 hours. What I usually do is I go to bed at 10, wake up at 2, feed them, and go back to sleep until 4 or till 6, and that way I get 2. It's not quite the same as a solid 8 hours, but you know, it's a little bit better. They can usually survive for that. You don't have to wake up every 2 hours because during the night that would be insane. There are people who do that, but I found that kittens generally survive for 4 hours without food. Let's see. After you fed them, you usually want to stimulate them to poop and pee because that's something that mama has to do too. Fortunately, unlike mama cats, you don't have to do it with your mouth. We can do it with toilet paper, and I will show you how to do that right now. Alright, and this is the setup for stimulating a kitten to pee. I have a little rag here that that I use basically as a kind of a litter box, a makeshift litter box until they're old enough to use a real one. What you do is you take a piece of toilet paper, you fold it up, put some warm water on it, and then you just gently lift the tail. I usually like to hold them like this and rub upwards like so. And pee happens, sometimes poop as well. Yeah. Well, I think he's gonna poop. Maybe. Maybe we'll be lucky enough to get some poop. Poop is good. We like it when kittens poop because it means that everything inside them is working. Alright. And there we go. You can, I probably can't see, but it's slightly yellow. That means that things are happening that should be happening. So, and he seems to be done. No, not quite done. Let's see. Come on, baby. Oh yeah, poop. When you've gotten into kitten fostering for a while, you will be surprised how happy poop makes you. Poop is like, excellent. This kitten is healthy. His digestive system is working. It makes you very happy. There we go. He's all done. He's ready to go sleep for another couple hours until it's time to feed him again. Now, they may still squeak after you're done with all of this, but usually you can tell when they're done eating. He's still kind of trying to nurse and everything like that, but I'm pretty sure his belly is still pretty full, so I'm pretty sure he's done for now. And if he's not, then he'll get fed again in a couple hours and he'll be all right. But you have to remember that they're used to having mom around all the time to suckle on and to snuggle up to and everything. And you can't be mom. You can't have that all the time. They have to kind of learn to live with your schedule. So, and they will. They'll adjust. Eventually, they'll get used to. I've only had these guys for about 24 hours. They haven't gotten used to being fed on a schedule yet, but they will. They'll get used to it. So. All right. Thanks, guys.